This is Dr. Mohan M R, consultant orthopedic surgeon and also medical director at Nano Hospitals, Bengaluru. So, what is a prosthetic leg? When there is a loss of an extremity, either in the upper limb or the lower limb, that is called amputation. When you have a loss of an extremity, that function has to be done by an external implant where you can put a prosthesis. It's not an implant, we call it as prosthesis, which is attached to the remaining stump, which can do a function of your lost extremity. There are various types of prosthesis depending upon the level of amputation. Level of, is it at the finger level, is it at the metacarpal level, is it at the wrist level, is it at the elbow level, is it at the shoulder level, or in the foot, is it at the toe level, midfoot, leg, below the knee, above the knee. So based on the location of the loss of extremity, different types of prostheses are available, and each prosthesis has its own functional capacity. Some are only cosmetic, some can do limited functions, some can have multiple functions. Depending upon the necessities of the patient, depending upon the comorbidities, other medical conditions, right prosthesis can be prescribed or designed in conjunction with an orthopedic surgeon and also a prosthetist. Of course, once it is helpful in patients who have lost an extremity for various reasons. It might be traumatic, ischemic, neoplastic, any reason might have been the reason for a loss of an extremity. But in today's world, with so many advances technologies, almost all functional capacity can be restored with these advanced prosthetics, including a competitive ports also.